Welcome to The Explainer. We're constantly bombarded with headlines about medical research. So today, we're going to crack that code. We're going to give you the tools to look right past those flashy headlines and really understand what the numbers mean for you. All right, let's just jump right in with a question that honestly trips up a lot of people, even people who read this stuff all the time. If you see an odds ratio of 2.0 in a study, does that just mean the risk is doubled? Simple question, right? Well, by the end of this, you're going to know exactly why the answer is a big fat it depends. So, to figure that out, we're going to build up a kind of researcher's toolkit. Here's our game plan. First, we'll cover the basic language of risk. Then we'll compare the big two, risk ratios versus odds ratios. We'll also look at what happens when time is a factor. And, most importantly, we'll translate all these ratios into something that makes sense in the real world. And by the end, you'll be decoding this stuff like a pro. Okay, let's get into it. We're going to start with probably the most straightforward tool in our whole kit. First up, we have the risk ratio, which you might also hear called relative risk. This is really your go-to measure for studies where researchers follow groups of people over time to see what happens. Things like cohort studies or those big randomized controlled trials. Now, I know formulas can look a little intimidating, but trust me, the idea here is super simple. All you're doing is taking the risk in the exposed group and dividing it by the risk in the unexposed group. That's it. It's just a direct head-to-head comparison. And because it's so direct, figuring out what it means is also really straightforward. If your number is bigger than 1, the risk went up. If it's less than 1, hey, it's actually protective. And if it lands exactly on 1, well, that means there's no difference at all. Let's make this real. Imagine a classic study on smoking. If they find a risk ratio for lung cancer of 7.0, well, the meaning is crystal clear. It means smokers are 7 times more likely to get lung cancer than non-smokers. Simple as that. But we can't always follow people for years and years. So what do you do when you have a study that starts with people who are already sick and then looks backward in time? That's called a case control study. And for that, we need a different tool. And that tool is the odds ratio. This thing is the absolute workhorse for those case control studies. Just to recap, in these studies, you start with the outcome, say a group of people with a disease, and then you look backward. So you can't compare future risk. Instead, what you do is compare the odds of having been exposed to something in the past. Okay, and this is where we have to be really clear. What's the difference between risk and odds? Well, risk is pretty intuitive. It's the number of people who had the event divided by the total number of people. But odds, that's a little different. It's the number of people with the event divided by the number of people without it. So yeah, they are mathematically different. A 1 in 4 chance gives you a risk of 25%, but the odds are actually 1 to 3. And this is a really big deal because it explains why you see odds ratios everywhere. If you're doing a case control study, it's literally the only measure of association you can calculate. On top of that, it's the standard output for one of the most popular statistical models out there, logistic regression. Okay, but it's not always as simple as did the event happen, yes or no. Sometimes the really important question is when did it happen? And to answer that, we've got to pull out some more specialized tools from our kit, ones that can handle time. So let me introduce the hazard ratio, or HR, and the incidence rate ratio, or IRR. These are our time to event specialists. Think about it. Say you're running a drug trial. People are going to be in the study for different amounts of time, right? Some might drop out. These ratios are smart. They don't just count who had an event, they factor in how long each person was actually followed. This gives you a much more accurate picture of the event rate over time. This type of chart, a Kaplan-Meier survival curve, is the perfect way to visualize this. You see those 2 lines? Each one is a group. What the hazard ratio is telling you essentially is how much steeper the drop is for one line compared to the other at any single point in time. It's all about who is experiencing the event, whether it's a heart attack or even a good thing like recovery at a faster rate. All right, so hearing that a new treatment halves the risk sounds amazing, right? But if you're a doctor or a patient, you're probably thinking, okay, but what does that actually mean for me? How many people are we talking about? And that question brings us to something called absolute risk reduction, or ARR. So let's just forget about ratios for a second. This is just simple, old-fashioned subtraction. You take the rate of the bad outcome in the control group, and you subtract the rate from the treatment group. That's it. So in a case like this, the absolute risk reduction is a nice, clean 15%. And from that one simple number, we can get to what is, I think, one of the most useful and practical stats in all of medicine. It's called the number needed to treat, or NNT for short. Let's say a big trial for a new statin finds an absolute risk reduction of 3%. To get the NNT, you just calculate 1 divided by that 3%, which comes out to about 33. And what this means is so powerful and so clear, you need to treat 33 people with that drug to prevent just 1 heart attack. Now that is a number a doctor and a patient can actually work with. Okay, so let's pull everything together now. We're going to create a kind of master blueprint so you know exactly how to interpret any study that comes your way. All right, here's maybe the most important rule of all. The design of the study tells you which tool you have to use. You don't just get to pick your favorite. So if you're starting with the outcome and looking backward, that's a case control study, you're stuck with the odds ratio. But if you're following people forward in time in a cohort study, then you get to calculate a true risk ratio. And believe me, using the wrong tool for the job, that's a huge fundamental mistake. Okay, so let's finally answer that question from the very beginning. Can an odds ratio of 2.0 mean the risk is doubled? The answer is yes, but only under one very specific condition, something called the rare disease assumption. Basically, if the disease is rare, the odds ratio is a pretty good estimate of the risk ratio. But once the disease becomes more common, the odds ratio starts to get bigger and bigger, and it seriously overestimates the true risk. So, bottom line, they are absolutely not interchangeable for common conditions. And one last thing, and this is super important. A ratio all by itself is only telling you half the story. You always have to look at its 95% confidence interval. A forest plot like this one shows you why. See that vertical line at 1.0? That's the no effect line. If a study's little horizontal line crosses that no effect line, then the result is not statistically significant. And also keep an eye on how wide that line is. A really wide one means the result isn't very precise, which usually means it was a pretty small study. So here you have it. Think of this as your master reference card, your cheat sheet. It brings all of these key measures together in one place. You can see which measure goes with which study type, what the null value is, and what it all means. It's the perfect quick guide for when you're trying to make sense of the evidence. So, what's the ultimate takeaway here? It's that a single number is never, ever the whole story. Whether it's a risk ratio, an odds ratio, whatever. It's just one piece of the puzzle. The most important first step you can take to becoming a really sharp, critical reader of the evidence is to always, always ask yourself, what kind of study was this? And did they actually use the right tool for the job?